What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have a super fun guest. This is one of our YDH Training Academy members who I've had the privilege to meet last year and just literally watch her blossom in Utah, which has been so good. She's got a special place in my heart because she's also a NICU nurse by trade, which that's where I came from. She's been in healthcare a long time, spanning over the course of 20 years. She is a nurse practitioner. She holds a nursing degree from University of South Alabama. She's certified and trained in anti-aging and longevity procedures to include hormones, especially pellets. So that is one area that we share. IV ozone therapy, although she's a boss, she does EBOO. It's not something we do in our practice, though. So she's definitely a guru. She also does peptides. I would say advanced growth factors, some cool regenerative medicine, IV therapy, joint injections. So yeah, very, very integrative, forward thinking. And she has just really, really grown into this role. And before we hopped on this call, it's just a lot of times we're saying in this type of medicine, we get to be the pioneers and the innovators and the thinkers. And sometimes it's like, am I doing this right? And it's like, it's kind of fun.
Right. Yeah.
Heather, are you ready?
New stuff all the time.
Yes. Heather, let's talk a little bit about how did you get into integrative medicine?
So like you said, my background was like NICU, ICU. So just the tiny babies. I think we do acute care really well, right? We get into that. ICU is really good.
Procedures.
Yeah. And all that. It's so fun. And it's fun to see them grow and everything in those settings. But I have family that have autoimmune conditions. I have family that struggle on that chronic end. And when I step back and realize, gosh, where are we failing? Right?
Yeah.
Where are we failing? And there's just so many, there's just Band-Aid approach. Like,
right.
I'll throw meds at it and they just stock up on all these meds. And I just really thought, gosh, where are we going wrong? And how can we fix it? There's got to be some way we can fix it.
Yeah.
So that's really where I got into it there.
For sure. So I always like to know kind of what brings people to the table when it comes to integrative medicine. So for the sake of today, what my goal is we just talked about the amazing Isabella Wentz on the podcast, and we talked about root causes of Hashimoto's disease and kind of, the core foundations of why it starts and what makes it worse. We talked about thyroid prescriptions and all those things. But what my goal with you today, my sweet friend, is I want to talk about all the advanced stuff that we do. So I want to talk about ozone therapy. I want to talk a little bit about our peptides and how we utilize that in the Hashimoto's arena, because I think it's important. And I think that's where practices like yours and mine really stand out is because we've got a huge toolbox, beyond just a little LDN and a little thyroid medicine and some herbs. Like we got all the things. And so let's jump in. So let's first talk about, why the thyroid, right? So let's talk about understanding Hashimoto's and why it's just beyond a thyroid condition. Can you talk a little bit about that?
Yeah. So Hashimoto's, it's a complex multi-system issue. I like to say it's an immune issue, not just a thyroid issue. It really is an autoimmune disease meaning that system is mistakenly attacking your thyroid. And so when you have that dysregulation, then you get that thyroid problem. So you really have to calm that down and figure out what is causing that so that you can fix these other things happening in your body in the thyroid.
Right. So when we think about Hashimoto's disease, I always say it's an autoimmune condition that with Hashi's, it's manifesting in the thyroid, right? But let's take some of our other autoimmune conditions that tools like EBOOs and peptides and ozone can help. Think about celiac disease, right? That's an autoimmune condition that's developing in the gut. Plaque psoriasis, that's an autoimmune condition that's developing on the skin.
Right.
Rheumatoid arthritis, autoimmune that's manifesting in the joint. So the reason why I'm pointing all these things out is because as Heather starts talking about how the modalities of some of these work, it's not like a pill for every ill. It's like you fix the root of the problem, which is an immune system issue. All these other things, get improved. And not only that, when you have one autoimmune condition, you're like 40% more likely to have another autoimmune condition. Yeah. Exactly. So it's an immune system issue. So let's jump in. How would you describe in an autoimmune kind of condition or an autoimmune landscape, how does ozone positively improve the immune system?
Oh, I love ozone therapy so much, right? So, ozone therapy, it is immune modulating. So, it helps that immune system, okay? It helps calms down that system, down regulates that overactive response that you're getting, especially when you're in a flare or it's active. Um, so that's key, right? Then you're not mistakenly tagging these other tissues and your body's not attacking itself. So it helps with
Right.
that. Ozone also, it can stimulate cytokines and those chemical messengers in the immune system. So it helps shift it from that overactive state into a balanced one. So that's why I really love ozone therapy, whether it's standard, high dose, or EBOO. Another thing I really see in this, it takes us from that inflammatory state and it can calm it down. So it has an anti-inflammatory effect on it, which helps neutralize those free radicals in there and lowers that chronic inflammation that a lot of patients come in seeing.
Right. Oh, absolutely. One of the markers that we look at in our practice as kind of like baseline, markers is CRP. I love it because it's cheap, it's easy to check. I mean, it's not the most specific, but it's better than nothing.
It gives you a good idea.
Exactly. Yeah. And I think this is a great way to try to look at oxidative stress in the body. Now, a really great marker would be like the 8-OHDG, which is what we see on the Dutch test. But a CRP, I think, is a great marker. And the reason why I think that is so important is because what ozone does is just as Heather said, is it helps release cytokines. And so when you have the release of cytokines, it helps with releasing some of the growth factor, and then it increases the production of some of the antioxidants. So you've got a oxidation and then the reoxidation of it. Yes, exactly. So it's kind of like, we talk about hormesis, right? So hormesis is like you're giving a low amount of stress to then trigger your body's immune response to be like, oh, we're going to upregulate.
I gotta fix it.
Exactly.
I gotta kick in. I gotta work all this.
Exactly. So we're going to overcome it. Can you explain a little bit, only because I'm not super familiar with EBOO, and I know that you do both. Can you explain the difference between ozone and EBOO?
So, I mean, EBOO is ozone therapy. It's just the amount of blood that I can treat at a time. So it will treat 2 pints of blood. So if I can do 2 or 3 therapies, which I typically like to do a week apart, I'm treating essentially their whole body. Plus, the nice thing with it is because it happens, the reaction happens in that diffuser, that it penetrates those red blood cells. And so you get a really strong amount of ozone therapy without overdoing it. And the benefits last for up to like 45 days. So you'll see a longer benefit to it. So with the standard and the high dose, which are great too, and I utilize those all the time, you have to do it more often. So you're treating more. So it's just, I can treat more blood and hit it faster with EBOO, which is fantastic.
Yeah. No, I think that's amazing. So in our practice, we typically start off with standard just to make sure patients tolerate it. And if they're going to have any kind of Herx response, and then we kind of we move everybody up to the high. Yes. We move to the high dose. And so what I was just kind of, you described, with high dose is I would say so one treatment of high dose would be like the equivalent to 2.5 times standard. And so it's kind of like you're getting more bang for your buck, especially, time is money kind of thing. And so it's like, I can have patients maybe come once a month, once every other week, depending on what I'm trying to treat versus having to come in every single week. So, so I think that's great. Kind of shifting gears a little bit here. Are there any maybe special cases that you've seen specifically with EBOO and Hashimoto's disease? The reason I ask is I have a really cool one where I've had patients where TPO antibodies were in the 600s, and we worked on her gut health, and we actually did ozone, and they're not detectable anymore. Which is great. Have you seen any cases like that?
Oh, yes. Yeah. It's so fun to see that. And we see them, they come in and they just feel terrible, right? They feel like crap. They are just not living. Now some of them, I've had some patients that have been living this for a while, right? And they have done the diet, the lifestyle changes and all those kind of things. And there's just been this missing piece to calm down that immune system. And it's been that ozone therapy that really has kind of tipped it up over that edge where they feel amazing. Right. And they're like, well, I don't know what it was, but this stuff is amazing. I'm like, well, yeah, because we're hitting your immune system, which is in a crazy state right now. We've never been able to calm that down, even with working on your gut and diet and supplements and all those kind of things. So yeah, I've seen them go from really high antibodies to undetectable, which is awesome. I also had another guy that he just crazy inflammation, not necessarily Hashimoto's, but he's got something going on, right? He's got some kind of autoimmune, crazy inflammation. He feels terrible. And he's done like 3 rounds of EBOO, and he just literally every week he comes in, he's like, you have saved my life. I have never felt better. And he's like, this has been a game changer for me. So it's really fun to see that and see, gosh, man, I knew it was going to be good, but to actually see it.
Yeah, definitely. Do you get a Herx response? Is it possible to get a Herx with EBOO?
Yeah, for sure. I tell my patients that there's a third of each population, right? A third of them go home. They don't notice any difference. They just feel fine. Like, I got an IV, great. Another third feel like really energized. They're like, I feel amazing. I feel like I can go and work out really hard. And then I get that third that get that Herxmeyer response where they still feel great. Usually it'll last a day or two. I feel like those are my chronic patients that have been living with this for a really long time, that just are super sensitive to anything that we do. I can usually say, yeah, you're probably going to be one that might not feel great for a couple days, and then that goes away.
Yeah, absolutely. Are there any symptoms that, like on a Hashi's patients, that you notice pretty quickly that get better, or is it kind of like more patient specific?
I think the majority of what people have responded to is just they feel that inflammation. They say, I feel like my inflammation is gone and it's amazing. And they're like, when can I do this again? Because I haven't felt that for a really long time. And I just feel like my body's always inflamed until we did this.
Yeah.
I think that's the biggest one that most people respond to quickest.
Okay. And then like in your kind of typical protocol, so before, do you just jump into EBOO or do you start with Ozone?
Each patient's a little bit different. If I have time, I usually like to do a standard with them just to make sure, hey, one, you're not going to have any response to it, right? We got to give some heparin with it. That you're not going to have a crazy Herx response, anything like that, or some weird, crazy thing happen. So if I can, I try to start with standard first and then move into the EBOO. But I also am checking labs too to make sure we don't have any crazy G6PD or any hemolytic disease, anything like that first. So yeah, if I have time, I like to do the standard first.
Awesome.
I think it's a good way to just kind of get them into it, and they know, I'm going to feel great. Plus, the EBOO is a little scary. It's a little scary seeing two things and you're hooked up to a machine.
Intense.
Yeah. So
I know I've talked to my procedure nurse, Leah, a couple times about getting it, and she's just like, what kind of shit are you getting me into now? And I'm like, but we see amazing results with the high dose. And for the type of patients that we work with, I feel like it's done a really, really great job. And so, I always say kind of in our practice, I don't treat Lyme, I don't treat mold, I don't treat SIRS, Epstein-Barr, that EBOO I know would be phenomenal for those patients. I don't treat those patients.
I don't treat them personally. I don't treat them personally either, but we have we have a couple other facilities. So Red River will feed into us, and they treat a lot of autoimmune conditions. And so they'll send them to us, or people have just researched it and realized they're looking for ozone therapy. Yeah. They're looking for that. And they come and they're like, I've got mold, I've got Lyme, I've got this. I'm like, it's great.
No, I agree.
Come do it.
And what's funny is, I'm always very clear with, this is what I do and this is what I don't do. And I tell patients, because they don't want to go anywhere else. And I'm like, I don't treat that, but I actually have a lot of tools that do treat it, but I don't really treat that, kind of thing. And so they're like, Can I try it? I'm like,
let's try it. Yeah,
absolutely.
I don't know.
Absolutely.
You had good response with that. I feel like we've gotten some good,
Yeah.
really good response with
Oh,
that.
yeah. Yeah. And I'm like, again, I'm not treating this, but if I were, I would maybe add in, this binder to you. And I'm going to add in
Yes.
some amlexanax. But again, I'm not treating your
I'm not
mast cell.
treating it,
I'm not
but
treating your mast cell activation. But if I were to maybe suggest something,
this is what you should do.
yeah. Yeah. I know. I know it's tough. We have such a busy practice and we're very blessed to work with so many great NPs. And it's just, again, we stay busy doing what we already do. And so it's kind of like, well, I don't know. We'll see.
Yeah. I
All right. Yeah.
You can get results with all of those great results with any kind of ozone. So
Absolutely. No, for sure. Shifting gears a little bit. Now let's talk about peptides.
Okay.
So one of the things that Heather also does is she also gets some of her patients on peptides. And I'm talking peptides beyond just GLP-1s. Like
Right.
GLP-1's amazing and it's really good for our autoimmune patients, especially our menopause autoimmune patients, which we tend to have a lot of. But we talk about some of the other peptides. So what would you say, Heather, like top 2 favorite peptides to support the immune system?
Oh, to support the immune system? Oh, man. Gosh. I really like the thymosin alpha-1. I think that's a great one just to kind of help that overactive immune response, lowers the inflammatory cytokines when we're in that. That's a good one. I really love BPC, KPV for our gut healing and those kind of things. So, I mean, I love it for other stuff, for all the joint stuff as well, but really specifically in the gut. Yeah.
Absolutely. Absolutely. So talking about we talked a little bit about, the premise of autoimmunity, and we always kind of say it starts in the gut. How, like when you're seeing a patient kind of for the first time and, you get those labs back and they have no freaking clue that they've got Hashi.
Right.
Like, what is your first step? Because and this is, as I train practitioners all the time and like I'm watching a patient and they're, the practitioners are like talking about LDN, they're talking about lorazepam and gluten-free diet. I'm like, they're like, they got this glazed over look in their eye. They're just trying to start on their vitamin D. Okay. And like get this pellet in their butt cheek kind of thing. So, I mean, like we could literally throw the whole kitchen sink at it. So what can you walk us through? Like, what's your stepwise approach? And like, when do you add a peptide? When do you do the ozone? Like, what does your kind of formula look like?
So here, kind of how we start, I like to focus like on liver and our liver health, the gut, that detoxification, the metabolism, those kind of things. So I love to do a liver detox with them first. And then we kind of go into each different things, right? We'll address the adrenal glands, we address the gut, but we like to do it kind of in phases because people get overwhelmed, right?
Yes.
There's so much and you're like, where do I start? And I think that's the biggest, when people hear these things or I say, listen, this is what we got to do. They look at you with this like glazed over look like, oh my gosh, right? So I'm like, no, we're going to break it down. We're going to make it easy and we're going to start in like baby steps. So I love to address diet and nutrition first, dial in whether they can go full anti-inflammatory if they feel like that can. I have some people who are like, yeah, let's do it. I'll do it. I'll do whatever you want me to. I have other people that are like, I don't know if that's something I can do. So we educate a lot on diet. We like to do a liver detox. We like to clean out, make sure those detox pathways are working how they should. And then, so I either anti-inflammatory if we can be really strong, or I'll say, listen, gluten, dairy, and for us, processed sugars, we don't have a big alcohol community out here in Utah. We do, but it's not as crazy. So it's those sugars.
I hear soda and big.
That's why we gotta.
Yeah, soda is like the thing out there.
It is. It's our alcohol out here, right? Those soda shops, the sugary pops. So that's where we usually will start, and then dive into that gut health, right? Because it really does start there in that gut, and we have to heal up those junctions so those proteins just aren't freely passing, causing more toxins and everything in our body. So. It's a process for sure. It's not a quick fix. This is a lifestyle change and an adjustment for people for sure.
Right. Yeah, no, I agree. What's hard, I would say, and again, like, I've had a hand in training you, so I kind of feel like, it's like almost talking to one of my own NPs is, what's hard is we see them on that first appointment, right, Heather? And they're like, every symptom and you're like, oh my God, is this perimenopause? Are we menopause? Is this your thyroid? No shit. It's Epstein-Barr virus. Oh God,
Right.
like,
What is it?
like that's
Where do
like,
we go?
like I always say, like, if you can see kind of what's happening in my brain when I'm doing a consult, like they're like, oh my God, this lady, she's, thinking of everything.
Oh, for sure.
But what's hard is, and I agree, like liver, like get people pooping. Like nobody poops regularly. Like when I
No,
tell them 30
no.
grams of fiber, they're like, oh my God. I think that's great. What's hard though is they're like, it's almost like you have to show them the small wins before then they
Yes.
commit to actually doing what you need them
Uh-huh.
to do. So I always
Yep.
say, and you know this because I talk to you guys all the time, your first 3 appointments with your patient is literally the most important. And so,
Mhm.
and if you're a patient, you're listening to this, or, if you've been my patient, you're like, yep, that's true because you know that we're like building out this relationship of I'm going to make you successful, but I need you to do
You
what
got
I'm
to do the
telling
work.
you to do. Yeah.
Yep.
So I tend to start with like, let's get, some basic stuff like vitamin D,
Oh, yeah.
making sure their methylation is good. So maybe getting them on a good methylated B vitamin.
Yeah.
I agree. Like perfect world, like let's go full, like I actually do a lot of Whole30 with my patients
Yeah, that's
because
great.
it's easy, because it's
It is
super easy.
Yeah.
I'm like, get you on a Pinterest board. Here's my favorite
There
podcast.
you
Like,
go.
here's my Costco list. Like, I try to make it
Yes.
so easy that they can't fail.
Yeah.
So I start there. And then I will, a lot of times I'll start actually with LDN. So low dose naltrexone.
Oh, yeah. LDN's great. Yeah.
Awesome. It's cheap. It's easy. That helps their
And they
chronic
feel good
pain.
really pretty
It
quick
does.
on it.
I know.
Yeah.
Again, small win, small, easy
Yep.
win. Sometimes I throw in a little semaglutide just to kind of get some of the baseline inflammation
Yes.
down.
Yes.
They start to feel a little bit better. And then I got them losing a little bit weight. They like their
Like,
husband
oh,
again.
hey.
And I'm like, all right, now it's time to get down to work on how to fix this thyroid.
Yes. Yes.
And so I agree with you. Gut Tides, hands down. So Gut Tides is made by a company called New BioAge. We carry it in our practice. I believe you guys
do as
carry
well.
it as well.
Yeah.
And so that's a combo of BPC, KPV. So great for relieving a lot of the inflammation. But then after that, if I'm like, okay, we're still not seeing the success, I then will add in something called lorazepatide. So
Yes,
lorazepatide, yeah, I'm not sure if you've used that one.
We haven't used it a ton, but
yeah,
I'm really excited to
love
add
lorazepatide.
more into it.
Yes,
Mhm.
yes. What's great about lorazepatide is so there was this researcher named Alessio Fasano, and he studied the whole premise of gut permeability and the junctions that open up, and so
Yes.
lorazepatide puts those junctions, kind of blocks the zonulin from attaching itself to. Zonulin is a protein that's in gluten. If you're a patient, you're like,
Yeah.
what the hell's zonulin? It's a protein that's found
What
in
is that?
gluten. And then it kind of breaks down that cellular wall of the gut lining. And so lorazepatide kind of bridges that junction back together. So you're kind of working on the inflammation piece of it with your gut tides, and then you're throwing the lorazepatide on there.
junctions.
Yeah, that's great.
Yeah.
So I would say that's kind of like my go-to stack. It's kind of like LDN, gut tides, lorazepatide. Then we're going to sprinkle some ozone right on top of
On
that.
top of it. Yeah.
Yeah,
I like
and
to
I-
hit them with ozone right from the beginning. If
Yes.
if they can come in and do it and they're close.
Exactly. I would say that's the hard part, is because the price tag of ozone is kind of salty, and I've not shown them any
Mhm.
success yet. I have to show them a little bit of
Yep.
success to be like, all right, this shit kind of knows what she's talking about. I'll go ahead and kind of
Yeah.
do it. And no, I think ozone's amazing. If I could start
Yeah.
every patient on ozone, that'd be great. But that's kind of the sequence that I similar to yours. But I think what's hard is sometimes people like, listen, I was on this wait list to see you for 4 months, and you're just telling me to take gluten on my diet. You know what I mean? Like, I'm like, okay.
Yeah. Oh, no.
Exactly.
Yeah. You
It's
gotta
just like,
kind of set up. Yeah. We'll do like our full panel, right? We all have
Yes.
our full panel.
Yes.
But I love
Yes.
when they come and they're like, oh, I've had a full panel. I'm like, that CBC
not
and
this
CMP
time.
is not, and your
Yeah.
TSH,
Yeah.
that is not a full panel.
Oh.
Like,
yeah.
we got to look at your vitamin D, your methylation, your blood sugar stability, your insulin
Yeah.
resistance, all those kind of things. So yeah, we hit it with the vitamin D and the methylation, and usually we'll kind of make a plan. I think for us, we have a lot of people that kind of know already.
Mhm.
So they've already felt like crap. They've already kind of started on doing whether their diet has already changed and those kind of things. So sometimes it's kind of lucky that we get to jump in and do some of these other things a little bit quicker than for some people where you're just telling them, oh, hey, have you ever heard about Hashimoto's? Because
yeah, because you got it. Yeah, absolutely.
And they just look at you like,
yeah,
oh, okay, nope.
Yeah, no, totally. And then you had mentioned thymosin alpha 1, which like I think is an amazing peptide to support the immune system. So I would say if I had like 3 or 4 Hashi peptides, it would be semaglutide, BPC-KPV,
tirzepatide, we love it here.
Lorazepatide, and then probably TA1. So all good stuff. So we talked about the ozone, we talked about the peptides. What about supplements? Like, are there certain go-to Hashi supplements that you find you like absolutely love? Tried and true?
Oh yeah. Okay, let me see. Where do I start? Sometimes they'll just look at me like, how much you want me to take, right? I don't want you to take everything, but I want you to take what you need. So when they're like in that main inflammatory phase, I love turmeric. We love glutathione, resveratrol. We'll use that a lot. Those are kind of our first 3 that we'll start with. And then gut tides. Love that. Vitamin D, man, everybody here in Utah needs vitamin D. So everybody ends up on vitamin D, and usually some kind of a liver complex methylation type stuff. What else? I also love, we have one that we utilize. It's a thyroid, like a thyroid complex that has zinc and selenium and all those kind of things in to help support the thyroid. So I love when I can use things that are stacked together in one pill. So they're not having to take 200 supplements. So those are the lot that we utilize. And adaptogens. I love to use adaptogens and work on adrenal glands as well.
Do you guys ever use thyroid glandulars?
No, we haven't used those ones.
Okay. So that is something we probably last year, I think we started using thyroid glandular, which is a desiccated cow. Cow thyroid. Okay. Yeah. And what we found is that we've seen some really great success with it in that patients who maybe don't want to get on a prescription. And so we're going to be able to kind of help support their thyroid a little bit more naturally. A lot of times I put them on a thyroid support where it's got selenium, zinc, and tyrosine and, adaptogen. Then I throw on a glandular. The cool thing with glandulars too, is it has, T3 and T2. It's got like the other, like the other kind of thyroid hormones in there. And so some of those autoimmune patients, they actually do really, really well.
That was going to be my question. Do you find Hashimoto's do pretty well with it? Because
I feel like
sometimes it's a
right. So many of my Hashi's patients, it's like, oh, the wind blew a weird way. Now their T4 is in the toilet when it was fine last week. Like to be honest with you, from a prescription perspective, I find that like my favorite combo for especially Hashi's patients is tyrosine and compound T3, sustained release, for a lot of reasons. Tyrosine is, very pure. The purity of it is good. It's very consistent. And I like Armor. Like, I don't want to say that I don't like Armor and P thyroid, but what's hard
for the right patients, right?
Yeah. 1 grain, which is 60 milligrams of Armor, has 9 micrograms of T3 and 38 micrograms of T4. Well, if I want to adjust one of those variables independently,
you can't
they only come in like, 15, 30, 60, 90, 120, kind of thing. So I'm like trying to do math and I'm like, break this pill, but skip it on Sunday. And then like, just lick it, put it back in the bottle, like it gets real weird.
It gets hard. And nobody reacts the same way. No patient. It's like, then you have to adjust it with everybody, which is
exactly. Then the other thing you think about too is sometimes, when they're generic, they can have corn in there, they can have, soy in there. And so sometimes there's something called molecular mimicry, which is where your body, even though it's corn, your body sees it as
something else.
Yeah. Right. And so then it's like, oh, no, we can't have that. And so here we're like, okay, I'm going to put you on Armor. It's going to be great. You're going to feel better. And then like, oh my God, this is terrible.
They feel terrible. Yeah,
exactly. So that's kind of why I like the tyrosine in that it's gluten-free, it's dairy-free. So it's just a little bit more predictable on that side of things. Do you have kind of like your favorite combo that you do, or is it just kind of like all over the place a little bit?
It's kind of all over the place, really, right? I have a lot of people already come in on medications, right? And I'll be like, do you have Hashimoto's? And they're like, what? You look at their TPO antibodies. I'm like, nobody has said this to you when you're seeing an endocrinologist, right? So trying to adjust from that, because I don't want to shift too much if it's working for them.
Right.
So,
oh yeah. Yeah.
but I found recently my go-to is just to be able to have them separate and to be able to tweak that T3 if I want to, and the
Yeah.
TSH. So
Yeah.
we have a hard time getting tyrosine approved out here.
Yeah.
I don't know
Yeah.
why. Sometimes it's a pain. So
Yeah.
I love that. If I could get everybody on, it'd be great.
Right. Most of our patients, we get it from Cost Plus. Like most of my
nice.
patients, we don't even bother. We don't even bother with insurance. We just go to Cost Plus. They pay straight up out of pocket. It ends up being cheaper than what a lot of co-pays do. So that's an online pharmacy. And yeah, I have my patients create an account. Let me know when it's created. I'll send it in there.
And I'll send it in there. That's smart.
Yeah, it's been really, really great. Cost Plus for that. I will tell you too, one of the biggest problems that I see is people do not convert T4 into T3.
Very
and
good.
So,
no.
Yeah. So some of the most common reasons why is stress, chronic infections. So we talked a little bit about some of the stuff that we don't treat. The other things are like nutrient deficiencies. So like just we said, vitamin D, selenium, those kinds of things. And so a lot of times, if I'm cranking up on a thyroid medicine and I'm like, okay, your T4 looks good, but your T3 is crap and you still feel crappy. I'm like, what's our reverse T3 doing? Then we get into the adrenals, right? Then it's like, I think some people start with adrenals, which I think is great. But what's hard is sometimes to do those behavioral lifestyle things, you have to give them, again, a small win to be like, okay, I can actually, go for this mindfulness walk that you're asking me to go on kind of thing. So how often do you feel like you have to do a cortisol test on your Hashi's patients?
Well, so if we do a plan, if we build out a plan, we include that into it. But I won't address that until a little bit down the road, because I feel like sometimes as we fix some of these other things, and I think we all have a component of adrenal insufficiency or, dysregulation. But as I fix some of these other things, whether it's the hormones, whether it's their pathways or just lowering inflammation, I noticed they feel a lot better. And you have those small wins in the front. So when you get to that point, adding in either like an adaptogen or adrenal thing like that, or saying, hey, I want you to do this and I want you to do this, it's not that big of a deal anymore for them.
Yeah. Totally.
So, but I mean, I will say we'll do them quite a bit. Or I have people come in and they're like, I want you to check my cortisol. Can you check it on that blood? And I was like, no, I don't like it that way. So if you really want to do it and you really want to dive in, like, let's do that saliva test. And let me tell you why, because how many times have I seen their cortisol's either really high or really low in the morning and crazy at night, but they just want that morning, right? Right. It was normal in the morning, but it was terrible at night. So
exactly. Yeah.
Like you would not know that if you're just looking.
Exactly. You're not going to get all that piece of information. Plus too, I will say, again, like I know kind of, in your sequence of hormones, again, only because you've been in my academy is I feel like once you add in a little bit of progesterone to some of these women in the luteal phase of the cycle, they're like, oh my God, I'm sleeping. I feel fine. I'm not anxious. I'm not irritable. Yeah. I'm like, well, shit, we don't need that cortisol test now. You feel fine.
I know.
So it's like, well, we fixed that luteal phase problem. And now it looks like we fixed your mood problem. Yeah. So yeah,
I always will usually say, let me fix this part first. And if we still feel like it's a cortisol, because it could be, then we'll address it then. But I think you're going to be surprised at how much you are going to feel better when we fix your hormones.
Yeah. It's amazing. And then what's great is, you've showed the patient, like, trust the process. And they're like, all right, they come in, I'm sure you're already at this point where they come in like, all right, Heather, whatever you think I need to do, I'm going to do it. Cause again, I would say, I haven't steered you wrong yet. And I'm not going to start now, Right. So yeah, it's good. Now, is every case a slam dunk? No, sometimes we gotta pivot here and there.
Yes.
But I would say, the beautiful thing about what we do is that our patients trust us. And I always say, like, listen, we're going to test it out. We're going to try something. And if it doesn't work, we're going to try something else.
We try something different.
Exactly. Like that's the beautiful thing is we got the biggest toolbox ever. And that's kind of why I wanted you on the podcast, is because I'm like, you do the ozone, you've got experience with the peptides, in addition to some of these other, more traditional modalities. So this has been so fun. Is there anything else, Heather, that you feel like we've not talked about?
No, I think this has been great. It's been so fun. It's fun to like chat about it
Yeah.
and share my passion and those kind of things,
Yeah.
especially you have those same passions, which is great.
Yes.
And I love learning from you, and I love hearing all your fun stuff because it's fun to see other people doing the same things.
Yeah. Yeah. It's very reassuring because just as we said before we got on the call, sometimes in this space, you can feel like you're on an island by yourself and you're like, is this right? Like, is this how it's supposed to be? So it's good. It's good.
Yep.
Heather, where can people find you? Like, where's your practice? What's the website? All those good things.
So we are in Spanish Fork, Utah. palmavitaclinic.com. So if you're out this way, look us up, or on Instagram, Palma Vita Clinic, or mine's Heather HNP. So if you're out this way, if you're in Utah or interested in ozone.
Yeah.
We'd love to talk about, we love to learn.
Tag all the essentials.
Love it.
No, it's good. Well, thank you so much, Heather, for taking the time out of your schedule.
Thanks,
and we'll make sure to tag you below. So if you're in the Utah area and you are into some integrative peptides, EBOO, ozone, gut testing, adrenals, Heather is your girl for sure.
We got you. Yeah.